Welcome to this edition of Compassionate Conversations. My name is Lynn Flanagan and I'm the CEO at Hospice of Rockingham County. Compassionate Conversations is one more way that Hospice of Rockingham County strives to connect with, care for, and support the community that we serve. Our hope is that we can provide education, not shy away from difficult conversations, and hopefully change some misperceptions that may surround end-of-life or serious illness care. We want to do all of that with dignity, respect, and compassion. Joining me today is Megan Cole, Director of Support Services, and Cindy Tuttle, who's the Director of Clinical Operations here at Gibson House. Thanks so much for being here.
Thanks for having us.
Yeah. So before we dive in, tell us a little bit about yourself.
Okay. Well, as you said, my name is Megan Cole. I am the Director of Support Services here for Hospice of Rockingham County. This is my 12th year on staff and my third in this current role. I have been a social worker here seeing patients in Gibson House, in their homes, in the hospitals, and in nursing facilities. My team works with the bereavement program, providing support. Our chaplains, of course, provide spiritual support, and I have the honor of working alongside of all of them.
Fantastic. What would you like folks to know about you, Cindy?
My name is Cindy Tuttle. I'm the Director of Clinical Operations here in Gibson House, which is Hospice of Rockingham County's 8-bed inpatient unit. I have 32 years of hospice experience, and I've spent a great deal of those many years here. I've been here for the past 10. I've been in a leadership role for, I believe, the last 8. We have a 24-hour staff of nurses and aides that provide care to our patients here in the facility.
Well, I just really appreciate your time today. So thinking about misconceptions, you know, a lot of times we'll hear people say that we have to go to hospice. Now, the majority of the work we do, we provide hospice care in the patient's private home, right? Wherever they call home. So usually they're private residents, but it could be nursing homes, could be assisted living, family care homes. But today we actually are going to talk about when you go to hospice, just to be clear. So I want to talk about Gibson House, and you just mentioned that it's an 8-bed inpatient unit. So let's start with maybe what is the difference with receiving care in your own home versus coming to Gibson House. What would qualify, if you will, a patient to come to Gibson House?
Well, if a patient was our home care patient to start with, coming to Gibson House could be because their caregiver needs a break. You know, they are exhausted, they in some cases are sick themselves or recovering from surgery. We've had families needing work done on their home. But for those 5 days that Medicare allows for respite breaks, the patient comes and we just love them up, take good care of them, give them anything they want to eat or drink. You know, we spoil them just a little bit, give their families regular updates. And then at the end of that 5 days, they're able to go back home. The other reason that folks come, of course, to Gibson House is for end-of-life care. Our hope is that for our home care families, we're able to provide the support and the teaching to keep their patient at home, their loved one at home, but that's unfortunately not always possible. You know, sometimes there's one person trying to do the job of what takes us an army here. Or the symptoms may just be more than we can manage at home, you know, pain or nausea. So in that case, you know, we have the conversation with the family about coming to Gibson House. And the nice thing about that is here, they can just be their loved ones. You know, they can just sit and hold a hand and not worry, how long has it been since this dose of medicine? Is it time for the next? And what is the symptom I'm seeing? Do I need to call the nurse back? We're just down the hall instead of a phone call and a drive away. So it's a very different level of care, but the goal is always to support the patient and family with whatever the need is.
So hospice in general, you know, Medicare gives us a time frame that's meant to be a guideline. But it is something that we have to pay attention to. So in order to be eligible for hospice, Medicare says that the physician has to feel that the patient has 6 months or less to live. But Cindy, talk a little bit about that, because the timing for Gibson House is a little different.
Right. The timing for Gibson House, if someone is coming here for end-of-life care, we're looking at approximately a 4 to 6 week time frame. Now, we know nobody has that crystal ball. Our home care nurses, if it's a patient that the family, is just not going to be comfortable with them passing away at home, they'll help them along until they feel like that we're in that 4 to 6 week window, and then that patient will transition over to Gibson House. If it is a patient who is in the hospital receiving care and the hospital physicians and the family, agree that, the time frame is in that 4 to 6 week window, and the family would desire them to come here, then we can bring the patient here for that end of life care.
Okay. And certainly you are right, nobody has a crystal ball. And, with physicians making those decisions, of course, that is a best educated guess. And sometimes not knowing what has led up to, let's say it's a hospitalization, or the patient's in the hospital when that decision's made to come here to Gibson House. We don't know exactly what led up to that sometimes, and things can look very different once they get here. So there's a lot of communication with the family, and the patient certainly too, but that's kind of constant. So that brings up a good point though. What happens if somebody happens to live longer than that 4 to 6 weeks that you're talking about?
Well, we try to educate families from day one and let them know that obviously our crystal balls are a little foggy, and sometimes what we think is going to happen is not the reality. What is really helpful is our attending physicians, when they round twice a week, our entire team goes to each patient's room to meet with that patient and family together. We give an update to the patient's family on how they're eating and drinking, how their symptoms are progressing, and if it looks like we may be looking at a longer time frame, we start to plant those seeds as early as we can, and we talk about, okay, if things continue on this track, if the person continues to show signs of improvement or stability, then what? And for some folks it looks like going home with hospice. For some people it looks like going into an assisted living or a skilled nursing facility with hospice following. For some folks, it means that their condition has improved so much that they can go to a skilled nursing facility for rehab care without hospice at all. So whatever the scenario is, our team work with the family to do what is in the patient and family's best interest. And we have the luxury of a little more time than we get like in the hospitals to do that discharge planning. We don't call them on Tuesday and say, you got to be out by Thursday. We work with the family every step of the way, because we know it's hard to hear in the hospital or at home that you think your person is in those final weeks, and then just a few weeks later you're being told, well, maybe not. That's a roller coaster, and we certainly understand how stressful that is and try to help the family along every step of the way.
So you mentioned respite care before we were talking about end-of-life care. So does the time frame apply, Cindy, to respite care, that 4 to 6 weeks?
No, it doesn't. For someone to receive those 5 days of respite that Medicare grants, all they have to do is be one of our hospice patients. And there doesn't have to be any specific reason. For somebody to come in for symptom management, they clearly have to have some kind of symptom out of control. But for respite, those are, those days that are just granted to them for whatever reason that the family or the primary caregiver needs. So they will, if they need to travel by ambulance, then the home care staff will help make arrangements to get the patient brought here. The staff here will provide the care for those 5 days, and then at the end of those 5 days, the person will go back to their previous living arrangement.
And we have seen it run the gamut for what the reasons are, right? We have had caregivers that needed to have their own surgery. We have had people who were going to be out of the country for a little while, or, you know, vacations. And a lot of times they do just need a break. So then it is up to the family. Like you said earlier, they can just come play the role, whether they're the daughter, the wife, the sister, whatever they happen to be. And then the burden of all the caregiving is on our staff, right? So what if my person was coming either for respite or for end-of-life care? What about visiting hours? Can I stay? What can we do?
We currently do not have any restrictions on visiting hours or a number of visitors. So we do keep our doors locked. So, you know, we are rather remote. So if somebody does come late at night, we do have doorbell, we ring that. We've got security, but people can definitely come and visit their loved ones, and they're encouraged to stay. We do have accommodations to allow somebody to comfortably, you know, stay overnight if they so choose. So there's great many reunions that happen in these rooms. There are some very special moments that happen there, and you hear laughter, and, you know, those things are just so wonderful. You know, when you get a family together that loves each other, there are fantastic memories being made in the midst of a sad event, but still great things happen in those rooms.
I'm glad you brought that up, because Megan and I were talking earlier that, you know, sometimes people will ask you, what do you do? And when people find out you work with hospice, usually I get one or two reactions. Sometimes the whole face goes, oh. And then, of course, it's usually followed, nice intentions, but, you know, oh, well, it takes special people. But what you just described, they're the special folks, the patients that allow us to come in during that time, and the families that open their doors, whether we're in their home or here. We realize people have a choice, right? And we are invited guests in a very personal and vulnerable time. But you also brought up something that I think is a misconception in the community, that everything here at Gibson House would be sad and everything would be dark. Not the case.
No.
Not the case. Yesterday in the hallway, we had a little tiny visitor, and he was going to see his person, and he takes off running down the hallway, you know, screaming her name. He is precious. But think about what has happened right here in this room. We've had Thanksgiving dinners where families came together. Patient was able to come. Pets can come. I know you've probably had some favorite pets that have come in.
Yes, I was thinking about the gentleman whose cat came with him, and the cat stayed on his bed the entire time. And I think one of our staff members ended up adopting the kitty after he passed away. But it was just so beautiful, and people whose pets, you know, they had reached the point that they just couldn't care for them at home anymore, couldn't care for themselves, but to see their faces just light up, you know, when that pet comes to visit. And one of them, I'll never forget this patient. I was telling her, you know, your dog could come visit, and oh, no, he's huge, he's wild. So I called her son and I said, I really think she wants her dog to come visit. No, I don't think you want that. He's huge, he's wild. Just bring him. That dog, it's like he just knew that his mama needed him to be on his best behavior. And he came in, and one of the biggest headed dogs I've ever seen, and he just laid his head on her like, hey, mama. And it was just magic. To see her face, to see his face, to see her son's face, it was just so beautiful to know that we got those two back together, you know.
And, you know, we talk about serving the whole family all the time, which we do, but if you are an animal person, that's part of your family.
Absolutely.
If it's me, I know a miniature schnauzer that's going to be right there in the bed with me. But I'm thinking about a big event. This has been several years ago, but I know you were definitely part of that. So talk a little bit about even having a wedding here at Gibson House.
So we were very lucky a number of years ago to be able to pull off a wedding. We had a patient here, and he and his fiance had wanted to get married, and unfortunately, the timing just didn't work out. And so we kind of got to talking amongst ourselves and decided we needed to make that happen, and we did. I made calls out to the local fire department, to various other places, because we needed some help. This was not going to be a small undertaking to get this done. But everybody that we contacted, yes, what do you need? We will be there. We had chairs, we had decorations, we had food. His church came. We had flowers. We had everything.
We had a cake that Cindy made herself.
Yes.
Beautiful wedding cake.
We had so much fun. It was
wonderful.
Probably the most fun event that I've been blessed to be part of here, and I think everybody that was a part of it felt that way. Yeah. The community room was packed that day. It was absolutely tremendous, and the couple was just beautiful. They were just beautiful.
And people wouldn't think of things like that, or maybe even the cat and the pets and all, but that's hospice.
Yeah.
That is honoring that life, and it's just the most beautiful ending. Yeah,
absolutely.
I get teared up thinking about it.
I know it. It's hard not to. So let's switch gears just a little bit, and let's just hit some of these misconceptions head on. Mm-hmm. So some things that we hear frequently. Well, they're not going to feed you at Gibson House. What would you say to that?
I wish we could quantify the amounts of ice cream and yogurts and puddings. The reality is most of the time when someone comes to Gibson House, their appetite is poor. A lot of these folks do have trouble swallowing. So most of them are, although if you have, been able to eat cheeseburgers and steak dinners, and we can certainly do that too, a lot of them, what they want are soft things or sweet things. We make a mean breakfast here in-house. Our nursing staff, we had to learn how to poach eggs for one patient because that was all she wanted every morning. I think it's very hard, probably one of the hardest things for a family member, and I've been through it myself, to see the people we love no longer want to eat and drink.
So much of our happiness in our lives centers around the dining room table.
Right.
That's where family gathers. When you are having a family get together, it is most of the time over a meal of some sort. So to see somebody not participating in that is gut-wrenching. It is.
But we will absolutely offer anything they want to eat or drink anytime they want it. If they want breakfast at 2 a.m., we may chuckle, but they're getting breakfast at 2 a.m. I'll never forget, we had a patient want chicken livers, and one of the nurses, God bless her, ran out and got them, called around till she found someone that was making them, went and got them. I think the patient ate 3 or 4 bites, and that was all they wanted. But they were so happy. And we really do try to accommodate whatever folks want, because like I said earlier, our goal is to spoil them, and we certainly are never going to deprive someone of something that they want.
A lot of times, like she said, they can't swallow safely. And so to introduce that food actually can create an additional discomfort for that patient. So in those cases, we do a lot of oral care with sponges and with a moisturizing mouthwash, or with, if the person likes Coke, you dip the sponge in Coke. It doesn't matter what the liquid is, you just want something to keep their mouth moist just because that feels better. And that's something that family members can do at the bedside if they so choose to.
So it is comfort. combined with the quality when we can, right? So something else that we hear quite often in hospice in general, but particularly here in Gibson House, well, they're just going to give you morphine until you die. That's a big one.
It's a very big one.
Let's just answer that.
So morphine is a pain medication that has been around for a long, long time, and it's stayed around because it's good at what it does. It is good at relieving pain, and it is very good at relieving symptoms of shortness of breath or that difficulty breathing that sometimes patients who are in that final phase of life will experience. It doesn't always take a high dose to manage those symptoms, and it doesn't necessarily knock people out. You need a low dose, and we do give the lowest dose that is effective. Not everybody that comes here ever gets morphine. If they're not experiencing pain or respiratory distress, then there's no need for it. So not everybody receives that. But if you do have significant pain, it is an excellent way to alleviate that suffering.
Absolutely. Thank you for that. That is something that can be very scary for people. And it's always amazing sometimes how misinformation can kind of catch on in the community, and that's what gets talked about. So I appreciate you answering that honestly and truthfully, so we can just continue to educate our community. So now let's switch gears, more of a social work issue. So why is hospice at Gibson House not always free?
Well, that is a tough question. Unfortunately, what Medicare reimburses is a small fraction of what it costs to run the facility. We are a nonprofit, and we are so fortunate to be blessed with a loving and very generous community. But the reality of it is Gibson House operates at a loss, and we do have to be able to keep the doors open to continue to serve our patients and families. So we do ask that when a patient is here and their symptoms are managed at their end of life, that the family pay a portion of the cost of their stay. That cost can be based on their income. We can work out payment plans. We can do lots of things to try to make it less of a stressor on the family. Our goal is to never have a family decide not to come here because they're worried about finances, because there are too many things we can do to alleviate that stress, help make a plan that they feel comfortable with. But it is an unfortunate reality that Medicare or insurance in general just does not reimburse as much as it costs to provide care to our patients here.
And you make a very important point that we never want that to be a barrier. So being a nonprofit hospice, of course, we always put people before profits. That is definitely something to emphasize. And just like we do with their physical care, and it's very individualized. So there is no cookie cutter care, but there also is no cookie cutter financial planning here either. So our billing specialists or social workers on your team would meet with each family, and that's a very individualized decision based on what they can do, whatever their situation is.
It's very individualized, and it's very private. The information that we receive and that we use to determine what the daily rate would be or the payment plan would be is not information that is spread amongst anybody else. We do understand that is very private information and take that responsibility very seriously.
Well, thank you. I appreciate you all answering some of these questions, and hopefully we have straightened out some of the misconceptions that's there in the community. But if there was one thing that you wanted our community to know about Gibson House, what would it be?
I think Gibson House is it is a wonderful opportunity for the staff to care for people. We appreciate the trust that is given us to take care of people's most important commodity, our loved ones. It is a nice, bright place, and it is there are very happy memories made here. I think that's the biggest thing, is that there are good memories made here. There are touching moments, and it's an opportunity for some very special time.
It's a privilege for sure.
It is.
Yeah, and we definitely do not ever take that for granted. So thank you so much for joining me today. So thank you for joining us for this edition of Compassionate Conversations. Please go to our website if you ever would like to learn more about Hospice of Rockingham County. That is at www.hospiceofrockinghamcounty.com. If you ever have a question that you would like to hear us answer on this podcast, please email us at info@hofrc.org.